Jadi untuk teman-teman yang ingin bertanya, silakan ketik di kolom chat dan jangan lupa untuk menyebutkan nama. Untuk pertanyaan, tolong diketik secara singkat dan jelas. So without further ado, I would like to welcome Dr. Eliza Hafiz to deliver the presentation. Dr. Eliza Hafiz, the time is yours.
Thank you very much, Miss. I don't remember your name, but Saudari Pengurusi Majlis saya panggil. Thank you very much for a very extensive introduction from the both of you. I am very honored to be presenting a very short lecture today. First and foremost, please bear with me and excuse me because I'm not very familiar with Zoom. I've heard lectures from other people using Zoom, but I have not had experience giving lectures using Zoom yet. So this is going to be my first time. So I'm expecting some sort of glitch from my side, especially when it comes to sharing of screens and other technical features that I might be using in this platform today. Just one lecture, just one question before I start my lecture. Should I be talking in Bahasa Melayu or English or a combination? Because my lecture, my slide is all in English, but I was hoping to be able to speak in both, a little bit of English and Bahasa Melayu, if you guys don't mind. Okay. Okay. So I'm going to try to share my screen now. All right, so I hope it comes up on your end. Has it come out on your end? Okay, I think it has come out on your end because I'm getting the screen now on my end. All right, so I'm actually very nervous to talk to you all today because this is my first time talking to other than my own students, like Malaysian students, what I mean. Okay, so I do not expect this to be a very formal session, but let's see how we go. Okay, so as mentioned by Saudari Pengurusi Majlis just now, for Miss Rina, questions will be asked in the end. So we'll have about 10 to 15 minutes of Q&A questions in the end for you to ask questions. So please write down if you have any questions, because normally if you know, it's very easy to get carried away listening to someone's talk and forgetting what questions do you have to ask. So please, if you have any questions along the way, write it down somewhere. Again, because I normally use Google Meet for my teaching and meeting, so we normally have the chat box on the right hand column of your computer screen. And normally people will start asking questions there, and I will normally stop after 20 minutes or so just to check on the chat box. And should there be any questions that I need to address halfway, and then just continue the rest of the talk. But anyway, it's okay. I'll take question in the end, but just don't forget to write it down somewhere. Thank you very much for Patria. I hope I get your name right in the end, Patria, for inviting me to give me this lecture. And I am very much looking forward to this lecture and actually meeting you all in this platform. I hope we can do it face to face, but perhaps this is how we should be start, how we can start on a much more for a much more session in future, hopefully, inshallah. All right, so like as as described by Miss Rina, my background is actually sports science, bachelor in sports science, and then I went to do my master's in physiotherapy in Australia. So it's a little bit of both. So I am um, uh, a practitioner, exercise therapist, as well as physiotherapist, both here in Malaysia and in Australia, when I was still studying and living there. So the knowledge that I'm going to share with you are quite an interesting approach of how we use water as a medium to treat our client, or a medium to prescribe exercise to our client. We'll see in a short while in the slides later how aquatherapy is not superior, but much more beneficial compared to a land or ground exercise intervention. Okay. So basically, these are the objectives of today's lecture. Okay. So at the end of this lecture, hopefully, again, the other questions I actually have to ask Patria before we start this. If Patria, I know you are listening, and if you can just feedback on WhatsApp to me. I need to know the population that is listening to this talk. As I assume it is mostly students, either physiotherapy students or exercise therapy students. But because I see because when Fatia gave me the numbers of respondent, about 200, more 100 to 200, I thought, oh, it could possibly also be people who are not students, but who they think that they're going to be beneficial for this talk. So I'm not quite sure how to actually maneuver the talk, but hopefully you get something out of this talk in the end. So this is the objective for this talk. It's about the 45 minutes talk today that we're going to be having. Okay. At the end of this lecture or talk, I hope you should be able, or you can, you are able to identify and discuss the physical properties of water that affects the ability to exercise in the water. Okay, so what is the difference about water that compared to a land exercise? So there are about 4 physical properties of water that is very beneficial to a lot of conditions. And when we talk about a lot of conditions here, I cannot list it down because it's just too many. And most cases, like musculoskeletal cases, right? Penyakit-penyakit yang berkaitan dengan musculoskeletal. So penyakit-penyakit seperti sakit pinggang, sakit at the back of the neck, knee problem, back problem, postural problem. Those are the problems that are commonly treated with water therapy. But it is not just limited to that. Okay, we have also seen exercise water therapy done in people with neurological condition, people with cardiovascular condition, people with chronic pulmonary disorder, people with all sorts of other diseases, illness. Okay, having said that, though, I mentioned illness, but there are some illness that might be a contraindication, which we'll also cover later when we get to the slide about indication and contraindication. Okay, So that's the first objective. We want to be able to look at what are the physical properties of water that can affect the ability of it as a usage in exercise and in water. And the next one is to define and explain the difference between assistive and resistive exercise in water. So you should be able to differentiate whether the exercise that you want to do with your client are type of assistive exercise or resistive exercise, because the two are actually giving a different kind of outcome. Okay. List the precaution and contraindication of aquatic exercise is very important for you as a practitioner, as a therapist, to be able to know what are the things you should be aware of before you start exercising in the water with your client. Okay, don't worry, although I have not given this slide to Fatria, but I'll be giving this slide to him later so that he can share it with all the participants later. Okay. Also, at the end of this talk, I hope you should be able to identify the advantages of aquatic therapy, therapeutic exercise. What are the benefits of it? What are the good thing that comes out of water exercise? Okay, so you should be able to list the advantages of aquatic therapeutic exercise. And last but not least, hopefully, at the end of this talk, you should be able to list the different types of aquatic exercise for each body segment. I wish if I can travel across the globe, if I can come to you, I really wish that we can do this as a 1 hour talk or 2 hour talk, as when I explain all the concept in water exercise in the water, and then we can all go to the swimming pool and do the practical session together. Having said that, because of the deterrent we have at the moment, at the end of this session, I'll be showing you. I'll be showing you some of the real life classes that I've done in teaching people how to exercise in the water. Okay, so I hope you enjoyed that video later before we end the lecture. Okay. All right. So what is aquatic therapy? Aquatic therapy is basically whatever using water as an intervention to prescribe exercise to your clients, to your patients. So you are actually using the benefits of the water as a medium that will be beneficial in producing outcome in the exercise that you are prescribing to your patient. Okay. If you Google, these are the things that you can just type on the Google box and then you get, like thousands of lists. But these three are the important and a very significant benefits of exercising in the water. First, it has no impact. So when you are in the water, you are basically gravityless. Okay, you don't have the gravity pulling you down, but you have the buoyancy. Okay, we're gonna talk about the concept of buoyancy as one of the properties of the water. But because you don't have gravity pull, so you don't have impact when you are doing exercise in the water. And I think when I said it should incur to everybody automatically, then when there's no impact, that means you can do as much as you want in the water without having pain. You're talking about somebody that comes to you with knee pain, or back pain, or neck pain, or any pain in the joint, whether it's is in the core or in the periphery. So it's one of the best exercise because it has no impact. So therefore, when there's no impact, you don't have to worry about putting the joint under pressure, putting impact to the joint. And when joint has no impact, okay, biomechanically we know when joint has less impact or no impact, the forces are all 100% done at the muscular level. So it's not just that you don't have impact to the joint, which in result reducing the risk, not reducing, actually preventing the risk of injury when you are exercising in the water, and you are actually maximizing the workout by exercising in the water. Okay, it's a total body workout. So if you are working in the water, let's say you are working with the water level at your uh, uh, pinggang punya level, okay, your tummy level, okay, or hip level, or slightly higher on your chest level. So everything that is under the water needs to work. Okay, so you can't just be you can't just wanting to work the leg and not working the core when you are submerged underwater. So katalah you're exercising up to the chest level, everything under the chest level is working out. So it's a complete workout, it's a total body workout, and that's a beautiful thing about it. Okay, so it's a beautiful thing about exercising in the water, but it could not be. That is why nanti later um uh during the later nanti we will see why you cannot stay doing aquatic therapy forever. Okay, aquatic therapy is something that you use as an adjunct to another treatment. um, you cannot be doing aquatherapy forever. So let's say you plan your treatment for 12 weeks, or 3 months or 4 months or 5 months, 6 months. You cannot be doing aquatherapy for the whole session unless it's really needed, depending on the condition of the client and sebagainya. Okay, but it's a good way to start because of this benefits and the property of the water. Okay, kita akan tengok later. So it has no impact, so that means it's very safe, and 100% of the force can be focused by the muscle producing work. It's a total body workout, and it's a total exercise program. So you can be getting all the components. So cardiovascular fitness component, flexibility component, muscle strength and muscle endurance by doing one particular exercise in the water. So it's a very time efficient kind of exercise. But then again, as I told you earlier, it is not the only treatment that you should do to your client. It can be an introductory treatment for somebody that doesn't want to do exercise, that somebody that is in pain, for instance, somebody that is having general weakness, and it to intro them to exercise, and so therefore they can develop some kind of cardiovascular fitness or stamina. They can develop some type of flexibility, muscle strength, and endurance during aquatic therapy exercise for you to take it out to the land exercise. Okay, so aquatic therapy exercise is the best exercise to start with a treatment before you follow through or progress to a land or exercise which is much more progressive and intensive. Okay. Okay. So here we have the properties and principle of the water. So there are 4 properties of the water that actually um, you don't get when you are exercising in the land. Okay, so when we are exercising on the land, there's no specific gravity concept to work working when we are exercising. There's no buoyancy concept. There's no hydrodynamics concept. There's no hydrostatic concept. So these are the concepts that makes exercise in the water different than exercising on the land. Okay. So specific gravity, this is I don't think how far should I go explaining about this, because I'm not sure about the population. So that's why I just have it in the point form and not describing it extensively in the slide, because again I was not sure of the population. But specific, okay, so I'll go through briefly one by one. And later, if you have any problem or questions, you can just ask me in the end, okay? So specific gravity, sometimes some books, some literature also regard it as relative density, which simply means the density of an object in relative to the water. So we know water is a high dense, water has higher density compared to the atmosphere and human body. So when we work in the water, the specific gravity or relative gravity of the water that is bigger compared to the human body makes that we float. Okay, that's why we float. Plus the concept of the buoyancy. That's why we float. Okay, the ratio of an object's weight. Okay, weight kita ni, I mean our body weight to the weight of a cube, to the weight of the water. Okay, so contoh, as an exercise students, if you remember, I'm not sure whether you've done this or not as a physio, but as a sport science student, you must have done this test with what we call body composition test, where you get somebody and immerse the whole person into the water and you measure the water dispersed. Okay, so that's basically an analogy to specific gravity concept. Okay, so if you have a glass of water and then you put something into the water, and then the displacement is the composition that your body is carrying, and that you are actually filling up for the composition uh, in the water that is displayed. So you are actually being part of the water itself. That's why that concept actually, when you are exercising in the water, you are getting that specific gravity concept to help you work out yourself as well. Okay. The buoyancy is the kadar terapungan. So when you is what we call, when we did physics back in the high school, it's what we call Archimedes principle of buoyancy. So the more fat you have in your body, the lighter you are in the water. Okay, so when you exercise in the water, body composition is very important. So the more, when fat people are not heavy people, fat people are light people, because fat is not heavy, muscle is heavy. So if you carry a lot of fat in your body, you float better than people who don't have a lot of fat in their body. Okay, but having said that, everybody will float. Okay, is in the water because of the buoyancy concept. So when you have the buoyancy concept, you will have to work more to make sure that you don't drown. Okay, so to make sure that you don't immerse under the water. Okay, so that's the second concept about physical properties of the water. And when we talk about buoyancy as well, there is also a point where we call center of buoyancy. Okay, kalau analogy center of buoyancy ni is like center of gravity of Earth when we are working in on the land lah. Okay, so you don't have we have the center of gravity as well when we are working on the land. So sama juga dalam air, tapi ke dalam air it's called center of buoyancy. So when you tilt yourself in the water, there is still a component of your body that works as an axis. Okay, and that point is what we call the center of buoyancy. And okay, so the next one is hydrodynamics. This is where the water works as a resistance to your body. Okay, and the water will act as a resistance to movement. That is why in the water it's not easy for you to run. You can barely run. You can only walk. Even we walking also, it's going to be a very difficult walk in the water. And that is because of hydrodynamics. And when we talk about hydrodynamic, there is a few components under it that will determine the level of dynamics in the water. We have drag, what we call water drag. So water drag ni analoginya senang. If you are swimming, wearing swimming clothes, you can swim faster. But if you are swimming using normal clothes, like what we are wearing now, then you're gonna have a lot of drag. Okay. The water, your outfit will be resistant to the water. So that is the concept of drag. Okay. And then next one we have viscosity. The viscosity or tahap kecairan air will also determine how much resistance you have in the fluid. Okay. The more viscous the water, the more the word is likat. I do not know what you guys call it there. The thicker the viscosity of the water, the more difficult for you to walk in the water and to exercise in the water. Okay. So that's drag and viscosity. And then you have all other and then you have two other component which is not quite existent in the swimming pool. We have the wave drag and then we have the frictional drag. Okay. Tapi kalau dalam swimming pool biasanya we have the two lah. We have the viscosity and we have the normal drag, okay, of the water. And that normal drag is coming from your own body properties, okay, what you wear dan sebagainya. That is why when we look at swimmers, when we look at people doing swimming for their sports, I myself is a sports person and I do triathlon. Okay, I swim, I cycle, and I run in the same event. For a longer distance of triathlon, take for example Ironman, they have to swim about 3.6 kilometers, and in order for them to be doing that quickly, they put on a wetsuit. They call it a wetsuit, and that wetsuit has a properties of fish skin. So why they put that on is because they want to reduce drag. Okay, so these properties, physical properties of water, you have to has to be taken into consideration before you prescribe exercise in the water for your clients. Okay, because when you know the concept, so you know, oh, if you feel the water is the viscosity of the water is quite thick, then it's going to be difficult for them to be working in the water. If then you know what kind of outfit they have to wear in the water. It's not just for safety reason, it's also because of the hydrodynamics concept of it. And last but not least, we have the hydrostatic pressure concept, which means that the pressure from the fluid that is exerted equally on all surface of an immersed object at any given depth. Okay, so it's like hydrostatic. It's a pressure compressing. So you have yourself. So you have the hydrostatic pressure constantly pressing on your body when you are underwater. So that by itself can be a comforting kind of like feeling. So contoh kalau you ada pembengkakan pada sendi ankle for instance because of you sprain your ankle, you just immerse your ankle in the water and you can already feeling comfortable. And that is because the hydrostatic pressure is kind of like compressing, enveloping and compressing your ankle, and that what gives it the feeling of comfort in the area. And having said that, because of this hydrostatic pressure concept, exercise in the water works well for people who have swelling in any part of the body, or in a technical term we call edema. Okay, I'm not sure whether you are aware of this technical term, but in hospital they normally, or clinically they normally describe this as edema. It's not just a normal swelling, but it's a edema due to post-surgical or due to treatment dan sebagainya. So the hydrostatic pressure concept of properties of the water really helps reduce edema in patient post-surgical, for instance, or for patient yang ada problem edema. Okay. So benefits of aquatherapy. I actually want to talk about the level of okay, so we go to the benefits of aquatherapy. So again, if you look up articles or if you just Google the benefits of therapy, you will be given list, and non-stop list about what can they do. But basically, these are the common ones. Okay, it improves your cardiovascular strength. Okay, I'm not sure how many. I don't know how many of you have done exercise in the water, as simple as swimming in the water or walking in the water. But you guys, after this, have to go and try doing some exercise in the water, and you should feel what's the feeling like after you done your exercise in the water session. It looks simple. When you are doing the exercise in the water, you don't really feel the intensity, but you will feel it after you get out of the swimming pool. Okay, and you can really feel that, oh, I'm actually doing quite a substantial cardiovascular workout when you are actually doing it in the water. But when you were doing it, compared to a land exercise, compared to cycling, compared to running, you can feel it. You can feel your heartbeat going faster, your heart rate increase, you can feel warm and sebagainya. But in the water, you don't have that kind of physiological feelings, and therefore you feel like you are not doing much in the water. But as you get out of the pool, after that, then you can feel a significant amount of work that you've done in the pool before that. It minimize the risk of injury. That is the most important thing that I want you to take home. Okay, when you are exercising in the water, the most important thing, the most significant benefit is that it's minimize the risk of injury, as I have discussed at the starting of the lecture tadi. Okay, it burns calorie because you work in the water, and therefore it is one of the best exercise for people who are overweight or obese, because it doesn't have impact to your joint. So I normally start people who are very, very morbidly obese exercise in the water, and as they start to get familiar, comfortable, get their fitness, and lose a little bit of weight, then I progress them to doing some land exercise. It enhances balance and coordination, because when you work in the water, there's no gravity that pulls you down. You cannot just sit and you cannot just stand on one spot. You will always be pushed and pulled by the drag, pushed and pulled by the water dynamic. So in order for you to remain in your static position, there is a lot of core contraction that needs to happen in the muscle, in the body, to maintain that ideal position of your standing. And doing that will, in a long run, enhance balance and coordination in you. And it is perfect for chronic conditions. So I've been physio for the last 10 years or so, okay? And I've come to realize that chronic condition is really, it's much more, not really, it's much more difficult to deal with compared to acute injury. And when we talk about chronic condition, and most of them don't only have one condition, and they have more than one. So it's very complicated to deal with. So again, why exercise in the water is good? Because it's a total body workout. So in order for you, so if you are doing land exercise, you have to do katakanlah, for instance, your client has knee problem, hip problem, neck problem, a couple of sore points in their body. Okay, a couple of sore point in the body. So how do you, if you don't have, if you know, if you want to be treating one body area at a time, it's going to take you forever. So if you put them in the water, you can kind of like work all the body parts together in one exercise. So it's time efficient as well as very effective in treating chronic condition. Okay. Exercise in the water has also been shown to improve mental benefits, mental health awareness. Due to this pandemic, COVID-19, everybody is very, very stressful working at home, not being able to see, friends, and not being able to do a lot of physical exercise. And mental health has been quite a big issue following COVID-19. So it is also one of the best exercise. I always like, when I ask my students, water exercise is one of uh, a module that I teach in my program. So upon finishing the syllabus, I normally take my student out to the swimming pool and we do a therapy, aquatic exercise. And of all the classes, that is what I normally find students enjoy the most, because they feel like they learn so much even in just a session of doing aquatic therapy. There's so many things that you can do, and most importantly, it's a very fun session. Okay, working in the water, it's fun, trust me. Okay, and that's fun. When we talk about exercise, we already know the fact that when you exercise, the body releases the endorphin, the feel good hormone, and that kind of stuff. And adding to that, the fun component actually uh, help to boost the emotional side of you, and reduce anxiety, reduce depression, and as well as stress. Okay, and it has been also due to that, you can get a better sleep. Trust me, if you go swimming, if you work in the exercise, if you work out in the water for katalah one session, and then from never been doing exercise, water in the exercise, and try to do water exercise, I only do it 30 minutes. And then that night, you're just going to sleep like a baby, because like I told you, because of the properties of the water, you don't feel like you are doing as much workout as you're doing on the land. But you are actually doing a lot, because you are working with a lot of component. Your total body workout, you are working all the physiological component in your body. And by doing that, you're just gonna get better sleep at night. Okay, because you work the whole physiological system, you work the whole body. And exercise itself has been proven to reduce anxiety, stress, um, and it also has been proven to improve focus, attention, and relieve depression. And the hydrostatic and hydrodynamic composure of the water has been proven to improve flexibility in the water. Okay. In the water, again, because of the hydrostatic pressure, because of the hydrodynamic, and because of the buoyancy, it allows you to move your joints across the full range of motion without feeling much pain. Okay, contohnya, kalau let's say you are restricted in your shoulder and you are working in the water, you are actually allowing the water um, to help you with the range of motion, and without you feeling that I'm actually pushing you, the water that pushes you um, are actually doing the work of a therapy. And therefore, if you're doing good enough intensity and frequency, that can improve flexibility. Water can cool body temperature if you happen to work with people with inflammation, okay, but be careful. Sometimes certain type of inflammation is a contraindication to water exercise. But we're talking about normal inflammation, post sprain, post muscle strain dan sebagainya. So there's an inflammatory process happening there, and the area is warm because that's how physiologically the body is when the body is repairing itself. So you can use the water to cool the body temperature and reduce the activity underneath the skin and around the area that is inflamed, and hopefully expedite the healing process. Okay, and it also build muscle endurance because, like I say, in the water, there's no way that you can just lie freely and not do anything. You will, even standing still requires you to do a lot of movement, a lot of co-contraction in your body to make sure that you are sitting in a nice posture, and therefore that kind of training unconsciously actually training the muscle in the body to have a better endurance to sustain longer contraction. Okay, so these are the normal equipment that we use in the water. You don't have to buy this if you are just starting an aqua therapy exercise. You can actually be creative and turn whatever you have in your kitchen into any of this equipment. Okay, all you need to do is um empty water bottle, for instance, or any foam that you don't use, and just turn it to be something like this. This exercise can be either assistive and resistive. Okay, so kita akan tengok what's the difference between assistive exercise and resistive exercise. Okay, so moving on to precaution and on contraindication. Um, Fear of water. So if you have somebody, your client is very scared going under the water, then it has to be, it is not okay. Precaution and contraindication are two different things. Okay, when you talk about precaution, it is something that you have to take extra cautious. Okay, but that doesn't mean that they cannot go into the water. Okay, but contraindication is something that you have to take into consideration a bit more, and most of the time it is not allowing them to go into the water, because if you put them into the water, whatever the illness that they're having or the contraindication that they're having is going to make it worse. Okay, it's not going to make it any better. So you these are just some of the precautions and contraindication. It's not, there are some other mm, precaution and contraindication, but these are just the some and the important ones. The first one is fear of water. Not everybody likes water, but once they are introduced to it, because a lot of people know, not a lot of people know when they are in the water, they have no control. Okay, the mother nature has control over our own body. Compared to exercising on the land, you can control your movement, you can control where you want to go, but in the water, you are not a boss to yourself. So a lot of people are scared to the water because of that fact. Okay, medications. Some medications are actually not contraindicated, but some medication have adverse effect or some side effects to their physiological symptoms. For instance, some medication affect some heart rate, some medication affect blood pressure, respiration, dan sebagainya. So like the puffer for asthmatic people, they affect the lung volume. So you have to be aware of that. If we already know that working in the water will definitely work the cardiovascular system. So if the medication they are taking is already increasing their heart rate, so perhaps you have to monitor the intensity of the exercise that you want to be giving them. Okay, it has to be very well monitored and closely supervised. People with ear infection are allowed to go in, but you have to be very careful, because when we work in the water, there is a possibility that the water will get into the ears and make it worse, because the water in the swimming pool or wherever you are doing Your treatment might not be clean, might not be treated properly. So when they get into the ears, it can make the ear infection worse. So be careful if you can get an earbud so that you can stuck it in the ear so that you will prevent from water from going into the ears and making it any worse. And people with specific condition, people who use wheelchair, people who have any walking disabilities, people who are generally weak, elderly population, for instance, um, people recovering from cancer. So those are the specific conditions that you have to take into account. Because when we talk about swimming pool, particularly, we have to remember that the water in a swimming pool is treated with chemical. So there could be a possible adverse reaction for people who have specific condition, especially skin condition or skin problems. You just your aim of your treatment is to make it better. Okay, you want to whatever condition that they have to be better, not to make it worse. So you have to take into consideration all these factor before you put them in the water. All right, so that's the precaution, and the contraindications are things that is definitely something that will deter them to going into the pool or basically pool. Okay, so illnesses. Okay, illnesses like especially illnesses that can be transmitted. So macam that why now sekarang ni COVID, the swimming pool is not open because although it is not proven that the virus can travel through water, but it can travel with from body fluids, and people pee and spit in the swimming pool, and that can cause cross contamination between individuals. So people who have highly contagious disease are not allowed to go into the pool. Okay, there's a big no that they cannot go into the pool. Okay, people who have flu or fever are also not advisable to go into the pool, just because again the swimming pool water is treated with a chemical, and you just don't want to make it worse. Okay, people who have open wound, yes, no, cannot bring these people into the water because it can cause problem to other people. So the whatever virus or bacteria that they have in the wound can be contagious to other people using the pool, and they themselves can also get bacterial or viral infection from the water that is not fully treated in the swimming pool. So people with open wound are not allowed to go into the pool. Okay, or other medical condition like people who are just had surgery, their wound is not well recovered. People with kidney diseases, because when we talk about people who when we talk about exercise in the water, there is a possibility that people will wee in the water and that kind of stuff. So you don't want to for that kind of unnecessary issue to happen, because it is not just bring harm to the person itself, also to the other people that are using the pool. Okay, so people who are having stomach problem, diarrhea, and that kind of stuff, it looks simple, but have a thorough consideration before you put them into the swimming pool. Okay. All right. So these are the principles and guidelines when we talk about exercising in the water. So those are the concept. On the left hand side are the concept of water properties that works when in the water, like I have explained earlier. So I'm not going to explain extensively on this one, but again, like the hydrostatic pressure is the one that will provide like a compression-like feeling, and it's very good for people with edema, okay, or swelling. The drag or the water resistant in the water, you can play around with because of the drag or the water resistant in the water. Then you will have to play around with the moment arm. Okay, so the longer the moment arm, the difficult is going to be for the exercise to be performed. So that is why when we swim, when we talk about swimming, we talk about pushing your in like a spear movement, and then bend your elbow and pull it back like that. If you go straight hand into the water and pull straight hand down, that's going to increase the drag, and but that's going to increase the level of difficulty of performing the exercise. But you are not teaching people to swim, you are teaching people to exercise. You can use the concept of drag or water resistance to progress your exercise. To make it easy, shorten the moment arm and you go into the water. Okay, the shorter the moment arm, the easier for the exercise to perform. But the longer the moment arm, the more difficult the exercise to be performed because of the concept of drag water resistance. Okay. You can progress your exercise in the water by speeding up the activity. So start running slow and then increase. The faster you move in the water, the more resistant you get. Okay. And buoyancy it can be used to determine the intensity of the exercise. You want people to the floater you are, the more immersed you are in the pool, in the water, the more difficult the intensity of the workout is going to be. Okay. And then we also have another component of progression. So again, like I told you earlier on, exercise therapy, aqua therapy is an exercise intervention that you're not going to be using it forever, but it's good for early rehab, introduction to exercise, and then even if you are only using it for a shorter time, this component has to be embedded in that short exercise prescription itself. Okay, so kita nak tengok satu-satu. So there are 5 stages. Okay, there are early stage, middle, advanced, and progression stage. Okay, so early stage where you should normally start introducing gait retraining. So katalah people who have undergone surgery or a motor vehicle accident, and then they just got out of their cars and sebagainya, and you want them to start training walking properly again. Okay, so in the water is the best time to do it. Getting range of motion, like I said, I told you earlier on, because the water is there to actually assist the movement, assist the limb, so you don't really feel like you are pushing your joint so much. So therefore, it's the water exercise can be used as at an early stage to improve range of motion. And by doing all this movement, you are actually starting up early strengthening exercise. The focus or the goal at this stage is to basically focusing on quality of movement and posture. So if you are doing like even a simple motion, moving the hand to the side with half of your body immersed in the water, you have to closely monitor the quality of movement and posture of that person whilst doing this, because your focus is really to get them to do a normal and good quality movement in the end, okay, when they have done all the rehabilitation. And then you're moving on to the middle phase, which is restoration of strength and endurance. So this is when, so you've done your early stage, so this katalah you've done it for katalah 2 to 4 weeks, okay, you're starting to see result, the person feels a lot better, a lot stronger, then you can start doing much more aggressive and intensive exercise strengthening and range of motion. Okay, this is the difference between assisted and resistive exercise. When you are at the early stage, that's where you use all the equipment that I've shown you in the previous slide as an assistive. So you don't use katalah, you have the float, You don't use the float to resist water, but you use the float just to assist your limb from moving. So you can promote range of motion dan sebagainya. And that's when you use the concept of assistive exercise earlier on. And then once you move to the middle phase, the equipment that you have can be used in transitioning from assistive to resistive. Okay, by using more emphasis and start to use the equipment. Kalau mula-mula ni you cannot use equipment for comfort dan sebagainya, you can use equipment, but if you want to use equipment in the early phase, use it as an assistive only. In the middle phase, where you can start introducing using equipment for resistive exercise. And then you're moving on to an advanced stage where you progress towards your goal. So your goal is to get this person to walk properly, independently, without walking aid, whatever your goal is. And then you start to think about, how can I improve this person's stamina? How can I improve this person's lower limb strength? How can I improve this person's core strength in order for him or her to be able to walk independently in the long run? Okay, so you in the advanced stage is where you start going on into more specific training of a depending on what your goal is. Okay, and this is where you start using the principle, the ABC principle of proprioception. Okay, proprioception is very big when we talk about water exercise, because like I said, the water dynamic will keep pushing and pulling you in the water, and that works very, very well for training proprioception. Okay, if you don't know yet, proprioception is a combination between the brain and the receptors in your joint, telling the brain and yourself where you are in the relative of the world. Okay, so contoh classical example I normally give and when we talk about proprioception, we normally talk about displacement and speed. Okay, so displacement and speed, and this is happening in the water. So the ABC's principle of proprioception is agility, balance, and coordination. So, and this is what you get. This concept can be practiced a lot more at the advanced phase, where you can start incorporating the usage of agility, so you can increase speed. Okay, at advanced phase is where you can increase speed. You can reduce balance. Okay, you, as opposed to water on your waist level, then you immerse more to the chest level, for instance. So you immerse yourself, so you reduce balance. And then coordination usage of a lot of sensors. Okay, not just a lot of turning dan sebagainya. Okay, so that is ABC's principles of proprioception, and that should be really emphasized in the advanced phase. Moving on to the last phase before we progress to transition to the land exercise. The end stage is where you should be prescribing your client with a sports or activity-related movement. Kalau your client is an athlete, then your exercise at this stage should be really focusing on a sports-related skill. Okay, kicking, kalau dia soccer player, you kick in the water. Kalau dia badminton player, for instance, you do a lot more regressive training of the external rotation of the shoulder, for instance. So really, at this stage is where you really have to hone in and really work on the sport-specific skill. And then you progress to transition from water to land. Okay, like I said, you cannot stay do your exercise forever in the water, but it's a very good introduction session to exercise in most cases. Okay, so the next 3 slides are about short video. They're very short one. Okay, about simple exercise that you can use in the water. Okay, the first one is something I got out of YouTube. The second one is what we did in USM. So you might see Fatria face in some of the video. You don't mind, Fatria? I use the video for teaching purposes. Okay, so let's enjoy this short video, and then I'll take questions after that. Okay, so that's how do I stop that? Okay, so yang ini yang kita punya session. Okay, yang ini the real life experience. So you might hear me screaming while teaching. I'll try to reduce the volume a little bit so that it's not too loud, because as it is, my voice is already too loud. Okay. Ini dasar tengah buat hip thrust. So this exercise is good for people with low back pain. Okay. So leg stuck on the wall. So if you can see here, okay, hip thrust up and down. So if you want to have more resistance, you can add more float or pull noodle. Okay, Dasa, I need you to do the exercise yang tadi tu. Okay, just relax. So now Dasa is doing neck exercise. So this is what we call chin tuck exercise. So the whole head down and up. So up, down and up. So pull, maksudnya kita letak tengah-tengah kepala and the whole head. This is also good for people yang banyak duduk depan komputer. So it's a postural reversal exercise. Okay, so if you can see, with this session, the pull noodle is used dua-dua as to meet the dua-dua component. Some of the pull noodle are working as an assistive device, and some of the pull noodle are working as a resistive device. So as one of the students are doing the chin tuck exercise, the pull under the head works as a resistive device, but the rest of the pull that is put under the body, the knee, the hip dan sebagainya is working as a assistive device to assist the body so that it doesn't sink. Okay, so there's another one. Ini dapat tengah buat hip thrust. Okay, so there's another one. The whole head.
Like a woodpecker, you know, like a woodpecker. Only the head moves.
Ni tak, ni dah salah. The whole head, up and down. You akan tanya, this is your challenge. Dasar. Yes. Yeah. Tapi dia silap-silap juga tau.
Yes.
This is so much fun, man. Okay, and there's another one in the end. Okay, this is just we were doing exercise for neck and back. There's a lot more other exercise that you can do in the water, and just looking at it, you know how much fun it is when you are exercising in the water. Okay, the last one is this. So this is when you are working in a group. So this is when you are working in a group. Faster. Right. Come on. So you are actually, you can see, it's not easy to work, to move in the water. Left. Pardon my voice screaming, guys. Okay, as you can see, guys, it's not easy to move in the water. It's really, really hard. And I normally, when I teach people to do exercise in the water, I incorporate movement like this, working in a group like this. So that will bring much more fun into the session. And when you do that, they don't actually feel like they're exercising. Tapi lepas tu, they feel like, oh my God, I've done a lot of exercise. I just didn't realize that I've done it when I was in the pool. Okay, so that's all for my talk. I think I've taken some time, a bit more time than given. But I hope I've given you enough information to spark your interest to doing some exercise in the water. And I take any question, if you have any question to ask me.
Okay, thank you very much, Dr. Eliza, for really interesting and important talk. Sekarang masuk ke sesi tanya jawab. Dari beberapa pertanyaan akan saya pilih dan nanti dari operator akan unmute. Tolong setelah saya memanggil namanya, tolong di unmute mikrofon kalian dan bisa langsung tanya ke Dr. Eliza. Ya. Pertanyaan pertama dari Muhammad Muklis. Muhammad Muklis bisa dibuka, open mikrofon.
Cek, halo.
Ya.
Yes, I hear.
Did you hear me?
Yes, I can hear you loud and clear.
Okay, ma'am. Thank you. Thanks a lot for give me time to asking you, ma'am. My question is, are this concept is capable for diet for like obesitas people, people with obesity, they won't able to diet, but it's too hard for them when they do cardio exercise every time. It's gonna make like they were suffer with it. Are this concept is capable for that, ma'am?
Yes, thank you, Mama Muklis, for your questions. Yes, this exercise in the water is a perfect exercise for obese people, as I have mentioned earlier on, because when you have somebody that is obese, like I said, like you mentioned, it's very difficult for them to exercise in the land because they are very heavy. So when they exercise in the land, when they are doing cardiovascular exercise in the land, they are putting a lot of pressure in their joints. And therefore, this is a situation, this is the exercise where you should be getting them to do, because when you get them to be doing exercise in the water, you automatically take the impact or the force or the stress that is going to the knee or to the joint out. So there is no impact to the joint, and they can enjoy the exercise more, as opposed to having to think, oh, when I do this, my knee hurt. When I do this, my back hurt. So yes, when you talk about obesity people, this is the best exercise they supposed to do. But again, it's not forever until they have gain some strength, some stamina, some fitness on their cardiovascular system, and until you are managed to reduce some of the weight, and then you can move on to doing land exercise. But to start with, yes, aquatherapy exercise is supposed to land exercise. Does that answer your question, Muhammad?
Yes, ma'am. Thank you for your answer, ma'am. It's loud and clear. Thank you.
For your question, thank you.
Oke, terima kasih. Oke, untuk pertanyaan selanjutnya dari Kak Melisa P. Handayani. Bisa open microphone.
Okay, thank you for the time. I want to ask, ma'am, when the physiotherapist can give the water exercise on the post-surgery, like total knee replacement or fracture, and any other similar condition. Thank you.
Okay, so when we talk about post-surgery, yes, when, the time is when, your question is when you can, okay. You cannot give the water exercise as part of the therapy until the wound has healed properly, okay. So until you or the doctor has confirmed that the wound has healed nicely, the wound is not infected, then you can start bringing them into the pool, okay. Because the issue is infection to the wound site, the incision site, okay. Other than that, it's okay. That goes the same with all surgical conditions. So post surgery, like for instance, mothers after delivery, cesarean section, moms, it's the same thing. Okay, you can bring them into the pool or start doing water therapy as soon as the doctor clear that the incision site has healed properly. Okay, because otherwise it can be contaminated with the chemical in the water in the swimming pool, and that can make it worse. So and it depends on individuals. Some people heal very quickly. Okay, when we talk about healing, it's not just the exercise, it's the nutrition as well, right? So you have to be taking a very good nutrition to heal yourself. And some people heal between 1 week, some people take 2 weeks, some people takes 2 months. Okay, so you cannot tell. So you have to work with your doctor, and you really have to work with the cardinal sign of inflammation. There are 5 cardinal signs of inflammation. You feel, if you are not sure, if there's no doctor, the incision site looks okay, so you go with the 5 cardinal signs of inflammation. So whether there's any redness around that area, whether there's any warm temperature, whether there's any deformity, pain, increased temperature on the temperature. So all the so those are the 5 cardinal signs of inflammation. And if the sign is there, you cannot start aquatherapy. But if it's okay, the doctor say the wound has healed and there's no the cardinal sign of inflammation, then you can start water therapy or aquatic therapy.
Okay, thank you.
No problem. Thanks, Melissa.
Okay, the next question dari Kinanti Asmara. Bisa open microphone. Kak Kinanti.
Yes, terima kasih untuk waktunya. I wanna asking, ma'am, where is better when we improve or increase proprioceptive? Where is better exercise in a water or inland? Because usually we are exercise to improve proprioceptive in a land. Thank you.
Okay. Well, the best is because when we talk about exercising in the land, there's so many things you can do. Because when we talk about proprioception, you really have to incorporate the component of speed and displacement. Okay, and you can do that in the land. But to start with, okay, we're talking about people after total knee replacement, for instance, where they don't have balance or where they have poor balance after surgery or after injury. Then you should start with exercising in the water. But like I said, you cannot do the exercise forever. For you to improve, especially in sports performance, for you to improve to get a better result, for you to improve, because ultimately, eventually, we are living on the land. We are not living in the water. So you have to take whatever that you are doing in the water out to the land. Okay, the land exercise is still the best exercise for everything. Okay, but the water exercise you can be used to stimulate the receptors, okay, at the early stage of surgery. For instance, you might not be able to do the land exercise for proprioception immediately, but you can do that in the water because you have the properties of the water, like the buoyancy, the relative gravity, that takes out all the hard component if you are doing it on the land. So on the land, there's gravity, there's impact to the joint. So you might not feel it comfortable to do it on the land as opposed to in the water. So you have to really weigh. If you want, the best is definitely exercising on the land, not in the water. But you can use exercise in the water to start or the proprioceptive exercise, especially at the very early stage of rehabilitation. But you cannot stay there forever, lah. Of course, you need to make a transition from water to land exercise. I hope that answers your question, Kinanti Asmara. I really like your name. I really like your name. I your face as well.
Yeah, thank you, ma'am. Yeah.
No problem.
I think it's enough. I'm understand a little maybe. Yes, thank you for the answer.
No problem.
Okay, for the last question dari Kak Afif Gufroni, can you open the microphone?
Bisa enggak moderatornya yang bacakan aja, Mbak?
Oh, oke. Jika aquatic exercise dimodifikasi temperatur, kandungan mineral, dan tekanan air, karena di Indonesia banyak pemandian air hangat di lereng pegunungan yang belum banyak dikembangkan oleh fisioterapis. If aquatic exercise modified the temperature depend to the air compression, modified the temperature of the water, could it be?
Yeah. So I think the question is,
okay,
what happens if you have hot water and cold water?
Modified, yeah.
Yeah. Okay. So yes, there's a concept of water temperature when we talk about aquatic therapy. Yes, you bring a very good point here, because in Indonesia, there's a lot of natural hot water treatment, kan? We have it here too in Malaysia. All the properties, the water hydro properties, the one that I've spoken just now, the four, are also the same, regardless of the temperature of the water. But what you have to be more careful with exercising in the hot water is the temperature of the water can increase the core body temperature. So you really have to make sure about your contraindication and precaution. Okay. The effect is as the same. Cumanya kalau the water temperature is hot, it's not suitable for inflammatory condition. Okay, it's gonna make it worse. Satu. And if the water temperature is hot, you cannot fulfill the requirement of the 30-minute exercise. So for instance, if you want to work your cardiovascular, it has to be low intensity 30-minute session of exercise. So if the water temperature is too hot, that doesn't allow you to stay in the water for a longer period of time. So you are not getting the optimum result of the exercise that you should be doing in the same water condition but cooler. Okay, and I am not sure about the viscosity, the drag about the water that has different temperature, because if in Australia, where I did my masters, they have a swimming pool with a heated temperature water. Okay, but that's different. That's where they bring up the temperature using device. But when we talk about naturally increased temperature and the minerals and other components that is in the water might have effect on the hydrodynamics, hydrostatic composure of the water component. Okay, so I do not suggest you to practice whatever that I've spoken here into hot water, because I have no knowledge about the component of the properties, the four that I've spoken to you just now, and how different it is when it is in normal ambience temperature and heated temperature, especially when it's naturally heated with by mother nature. Okay, so I'm not sure, but I don't recommend you to exercise longer time in hot water condition, because it can promote increase in core body temperature, which is not good generally. Okay, so you want your core body temperature to stay the same, and generally with exercise our core body temperature will increase, and we don't want that to happen from the water, from the outside, from the external source. Okay, so I don't recommend doing the therapeutic exercise in the water. Again, when we talk about doing exercise in the water on the land, you still have to fulfill the guidelines, the FIT rules, okay, the frequency, intensity, and the time. So let's say you want to work on cardiovascular endurance, the exercise has to fulfill some timeline, which is 30 minutes minimum. So it still applies even though you are doing it in the water. Okay, so that's why therefore I don't recommend doing those kind of exercise in the hot water, naturally heated pool. Okay, because of the component of the mineral, the natural mineral, and all other adverse effect that can affect your physiological system. Okay, I hope that answered your questions. I'm not sure about the content, to whether it will make I have not looked at any evidence, okay, any paper, which I will, and I will post, I will update Fatria about it, about natural, but I myself, I am not aware of that, and I don't recommend doing therapeutic exercise in a naturally heated pool or water. Okay.
Okay, thank you very much for the answer. I will step to the conclusion of this presentation. Aquaterapi biasa diberikan pada kondisi musculoskeletal disorder, neck pain, dan low back pain. Dan aquatic therapy adalah penggunaan air sebagai media yang akan bermanfaat sesuai dengan kondisi dan tujuan dari pemberian exercise-nya. Air tidak akan memberikan efek negatif pada sendi ketika seseorang melakukan exercise di dalam air, dan efek total body workout didapatkan tergantung pada level of immersion dan di level mana aquatic exercise berefek pada hampir seluruh komponen di dalam tubuh, cardiovascular, flexibility, muscle strength, and muscle endurance. Dan sampailah kita di bagian akhir dari presentation session, and we would like to say thank you very much to Dr. Eliza dan terima kasih kepada teman-teman semua yang dengan semangatnya mengikuti science lecture hari ini. Hopefully the presentation will be beneficial for everybody. Dan terima kasih untuk perhatiannya. Waktu akan saya kembalikan kepada MC.
Baik, terima kasih kepada Dr. Eliza Hafiz, Magister Physio, selaku pemateri yang sudah meluangkan waktunya dan sharing ilmu kepada kita semua, serta moderator Saudari Rina Ainul Mafiro, dan terima kasih juga untuk para peserta yang sudah berpartisipasi pada webinar hari ini. Sekian untuk Science Lecture pada hari ini. Semoga apa yang telah disampaikan bisa bermanfaat untuk kita semua. Saya memohon maaf apabila ada kesalahan yang disengaja maupun tidak disengaja.